بسم الله الرحمن الرحيم. أنا هيثم نبيل خالد, final year medical student from Baghdad University College of Medicine. Welcome again to Antibiotics in Clinical Practice. In this lecture, we are going to continue the other nucleic acid inhibitors. Objectives is to know the spectrum of activity and some of the clinical uses of the three antibiotics راح نحكي عليها هي الfolate antagonist, nitromidazoles and nitrofurans. Folate antagonist. We will begin by the famous trimethoprim sulfamethoxazole, known commonly as methoprim. طبعا هذا الايجنت كان في زمن معين كان broad spectrum agent, بس خلال السنين صار ضحية للانتيبايوتيك ريزيستنس وبقى عنده استعمالات محددة راح نذكرها. The spectrum of activity, it is good against staph including many MRSA strains, خصوصا المرسا strains اللي تكون community acquired rather than hospital acquired. So it is one of the few antibiotics that work against MRSA. It is also good against Haemophilus listeria and pneumocystic infections that commonly occurs in patients who are immunocompromised and AIDS patients. Moderate against enteric gram-negative routes and other gram-positive like Streptococcus pneumonia, Streptococcal pyogenes, and other gram-negative like Salmonella, Shigella, and Nocardia. And poor against Pseudomonas, Enterococci, and anaerobes. In the red, I highlighted the important things to remember. For years, methoprim was the standard first-line therapy for the treatment of acute and complicated cystitis in women. It is still areas of low antibiotic resistance to methoprim, it is the agent of choice for this condition. It is also used as a prophylaxis against recurrent urinary tract infection, but it should not be used for the empirical therapy of complicated UTI. And I mean by complicated UTI, pyelonephritis, يعني upper urinary tract infection, or urosepsis. It is also used for the treatment and prophylaxis of pneumocystic infections in patients with AIDS. It is also an alternative therapy for bacterial prostatitis, typhoid fever, and MRSA infections. We know that MRSA infections have a few agents to work on, and we have already discussed vancomycin. That was the agent of choice for MRSA infections, and now we discuss the methoprim. Nitromidazoles. The agent is the metronidazole, known as the flagell. The spectrum of activity is good against anaerobes, but you should know that it is good for abdominal anaerobes rather than oral anaerobes. It is also good for protozoal infections like Trichomonas, amoeba, and Giardia. It is moderate against Helicobacter pylori, and it is poor against everything aerobic. And it is also we repeat, it is not good against anaerobic infections that reside in the mouth, anaerobic bacteria species that reside in the mouth. It is used for infections with documented or suspected abdominal anaerobic bacteria. It is used for anaerobic infections below the diaphragm, like an abdominal abscess, for example. But it is not used for, like example, aspirational pneumonia. يعني الانفections, anaerobic infections above the diaphragm, other agents should be used rather than metronidazole because it will miss some of the anaerobic bacteria species that commonly cause anaerobic infections above the diaphragm. يمنع كلش هواية يستعملوه كبروفيلاكسس before abdominal surgical procedures and part of the chemical preparation of the bowel, also used prophylaxis. It is used also in H. pylori eradicational therapy. one of the 3 or 4 agents that are used for H. pylori eradication. It is used for mild to moderate Clostridium difficile infections. It is the first line therapy for these infections. Remember, it does not have activity against anything that is aerobic. So when there is a suspicion there is also an aerobic infection, with the anaerobic infection, other antibiotic should be used with the flagell. Nitrofurans, we will speak little about this. The agent is the nitrofurantoin, and it is good against Escherichia coli and Staph saprophyticus. طبعا Escherichia coli is the most common cause of urinary tract infections. So their utility is limited to treatment of uncomplicated cystitis in patients with adequate renal function, and also prophylaxis. So treatment and prophylaxis of uncomplicated cystitis with patients with adequate renal function. It should not be used for anything except this. It should not also be used for more severe urinary tract infections such as pyelonephritis and urosepsis. مثل ما قبل شوية قلنا إنه الميثوبريم should not also be used for these upper UTI and urosepsis. This also should not be used. This is a treatment failure waiting to happen. So in summary, we have 3 antibiotics today: the methoprene, flagell, and nitrofurantoin. The methoprene, it is good against staph. It is one of the few that works on MRSA. It is variable against strep, but it is good for gram-negative roads. That's why it is used for urinary tract infections. It is poor for everything else. Flagell, it is only good against anaerobic infections. And it, remember, for the second time we repeat that it is not good for anaerobic infections, anaerobic bacteria species that are in the mouth. Only for anaerobic infections below the diaphragm. And the third one is only nitrofurantoin is only good for gram-negative roads, and it should only be used for uncomplicated cystitis in patients with adequate renal function. This is all for this lecture, and thank you for watching.